Good day and welcome to the Editor's Podcast. This is Dr. Linda Snetselaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. And with me today, I have Dr. Asher Rosinger, who is an Associate Professor of Biobehavioral Health and Anthropology, and also Director of the Water, Health, and Nutrition Lab and Environmental Health Sciences Program Area Leader at Penn State. He was guest editor of the Journal of the Academy of Nutrition and Dietetics special issue on water. Welcome, Dr. Rosinger.
Thank you so much for having me. I'm happy to be here.
This particular issue, where you served as a guest editor, focused on water security. Why is this topic important today? And to take that a little further, what are the similarities and differences when this topic is explored in high versus low income countries?
So, water insecurity is a concept that has developed over the last 20 years from an understanding and thinking about as it relates to the amount of water in the environment to a more experiential lens. And what I mean by that is how individuals experience different water challenges in their day-to-day lives. Water security is incredibly important because it's one of those essential nutrients that we often take for granted. In the United States, in particular, we turn on the faucet for the majority of us, and nary a thought goes through our heads in terms of whether that water might be contaminated or sick. The water comes out clear. We go to the tap. It's very simple. But over the last 10 years, more and more challenges have emerged in the United States with challenges as it relates to infrastructure failures as well as extreme climatic events. So there have been several different extreme climatic events, winter storms, for example. We just here in Pennsylvania and throughout a lot of the Midwest of the US experienced an extreme cold spell in late January 2026. And some places had water mains that froze. And as a result, people could not get clean water. They got notices of boil water advisories indicating that their water is not safe to drink. Now, in a high income country, water insecurity can present itself as a challenge that's slightly different than what we've studied traditionally in low income countries. In low income countries, issues of water insecurity frequently manifest as people not having access to clean water. They don't have taps in their homes. They have to walk maybe a kilometer, 5 kilometers to get to surface water. Now, that water not only is far from their house, and there's a large toll that goes into the physical labor of bringing that water to the home, but it's also unsafe to drink. So they're encountering a number of issues as it relates to water. In high-income countries, the challenges of water insecurity can manifest slightly differently. So here, there might be water contamination issues, but there can also be issues around affordability or water shutoffs. And increasingly, we've seen different water contamination crises, like in Flint, Michigan, between 2014 and 2016, then in Jackson, Mississippi, and Newark, New Jersey, where there was lead in the water, and that led to many negative health outcomes.
Thank you. So interesting to sort of look at what is going on in our country that definitely has some bearing on water quality. Thank you for that. One of the underlying themes in this issue was the relationship between water security and food security, which I thought was very interesting. Please, would you discuss how these two issues are related? And are there any surprising findings concerning the relationship between food and water security?
Water insecurity and food insecurity have been studied for, I would say, the last 10 years, especially in low-income countries, but only recently has research started to dive into whether this co-occurring issue is happening in high-income countries. Now, most of the research that's looked at the relationship between water and food insecurity has really shown that water insecurity is driving food insecurity challenges as opposed to vice versa. And the reason for that is that to cook a healthy, balanced meal, you need clean water. It is incredibly more challenging to wash, fruit, to cook whole foods, to even make rice if you don't have water available to you.
Yes, that's so true. Water is hugely a part of everything we do in terms of food in our homes.
Absolutely. And if you don't have clean water, if you don't trust the water that you have in your house, then frequently people, well, they have to rely on bottled water, and it's incredibly more expensive and onerous to try to cook with bottled water than it is by just having clean tap water. There's also been some work that's shown that when people are water insecure and they don't trust their tap water, they are more likely to go and get prepackaged foods, ultra processed foods, and eat out at fast food restaurants, all of which have been associated with a higher risk of weight gain. And so I think in this special issue, a lot of the different contributions are starting at that point and showing that water and food insecurity, yes, they're co-occurring, but they also have negative health effects on a number of nutritional outcomes that we as nutritionists care about. Things like how mothers are feeding their young children, if they exclusively breastfeed or not, how it relates to childhood diarrheal illnesses and potential stunting or wasting. And all of those health outcomes are critical to understand because they have lifelong consequences.
Yes, so incredibly important. As we're looking then at water insecurity, the concept of water quality, both objective and perceived, is also incredibly important. Please, would you discuss how your issue sheds light on this point?
For the longest time, people were really interested in understanding, okay, if you have contaminated water, water that has fecal contamination or some other contaminant of public health concern, what does that do? What are the nutritional outcomes for that? And in this issue, we have a couple of different contributions, one by Josh Miller et al., an assistant professor at Buffalo University, and then another contribution from Kadir Roba, who's here at Penn State University. And both of those papers do a really nice job of examining how the risk of having E. coli contaminated water is associated with early feeding practices for children. In Miller's contribution, they're looking at nationally representative data from Ecuador, and he's looking at both water quality contamination and food insecurity, and then how that's associated with whether moms exclusively breastfeed until 6 months, which is the World Health Organization's recommendation, and then whether they are introducing or feeding their children formula. And what he finds is that women whose households have water that it has the most amount of E. coli contamination are more likely to exclusively breastfeed and less likely to use formula because they're perceiving that their water is unsafe. And so they want to protect their babies. Now, what's fascinating is that in a completely different context of rural Ethiopia, the Roba contribution shows the opposite example. So there, he shows that a number of water challenges actually lead to moms terminating exclusive breastfeeding before 6 months of age. And in that context, people do not have taps in their houses. So people are oftentimes having to walk to fetch water. And as a result, they don't have as much time to feed their children. And so the context here of having, tap water in your house that you think is dirty versus having to spend extra time and labor to fetch water that may also be unsafe have very different results in terms of how it affects early childhood feeding practices. And so that's the objective water quality. Now, in the issue, we also have a few contributions that look at perceived water quality. So whether the households, the men, women, are perceiving that their water is unclean, regardless of whether it is or not. And in all the contributions, kind of the takeaway message is that yes, it's not just objective water quality that matters. If people perceive their water to be unsafe, if they distrust it, they are more likely to drink sugar sweetened beverages like sodas. They're more likely to eat less healthy foods, and they're less likely to have a healthy diet. And so, in this way, perceived water quality is just as important as objective water quality in terms of changing people's dietary behaviors. And I think what that means for nutritionists is that when you're talking to people about what they're consuming, you need to understand both whether they have access to clean water, but also how they perceive their water. Because even if they have clean water, if they don't think that it's safe to drink, they're not going to drink it and they may switch to less healthy beverages.
So incredibly important. And I think too that insight, just as you were saying, is valuable in terms of what the RDN does in terms of clients. If you were to look at the issue that you guest edited, what are three takeaway messages from that issue?
So beyond the one that I just kind of said, I mean, I guess the three takeaway messages are that number one, both objective water quality as well as perceptions of unsafe water and water insecurity really matter for what people are drinking and eating. If people are perceiving their water to be unsafe or that if their water is unsafe, that can have real consequences in terms of how they feed their children, in how they are thinking about what beverage to drink, oftentimes selecting sodas or other sugar sweetened beverages because they think this is a safer alternative. And that can have real consequences for extra calories, extra added sugar, which have downstream negative health outcomes for cardiometabolic health, weight gain, things that we really care about. The second key takeaway is that extreme climatic events and natural disasters create shocks with ripple effects through water and food insecurity. And that can negatively affect childhood nutritional outcomes and extend into mental distress. So there are a couple of contributions that really try to understand these extreme climatic events like repeated flooding and how repeated flooding can have negative health consequences on stunting and wasting of children in Bangladesh, but also natural disasters. So following a volcanic eruption in the Kingdom of Tonga, Hilary Bethencourt and her colleagues showed that when residents had water and food insecurity following this natural disaster, not only did it lead to higher levels of both of those resource insecurities, greater levels of water insecurity, greater levels of food insecurity challenges, but when people were experiencing those, that led to greater psychological distress. So they're experiencing nutritional stress, and that has real consequences for mental health. And then the final takeaway from the issue is that key interventions really matter. Key interventions that increase access to clean water can have nutritional benefits and be health equitable and cost effective. So, in one of the contributions, Angie Craddock from Harvard University and colleagues really highlight how water dispenser interventions in Massachusetts schools If they're installed near lunch lines, they can prevent added weight gain in kids, especially in the most marginalized kids. So kids living in poverty and kids who are Latino or Black. And in their analysis, they showed that, this type of intervention would only cost around $4 per student and would prevent about 9 cases per year of development of obesity and overnutrition. And so that has real health benefits for the school system and for those families.
Thank you. Very important information again. I know that you've touched on this already, but I'm wondering how an RDN might use this information working with clients.
Sure. So I think that number one, awareness of people's experiences with water is critical. For a long time, when you go to the doctor's office, they'll give you different screeners. One of them relates to food insecurity. In the United States, we've understood that food insecurity is tied to nutritional status for a while, but only recently are we starting to get evidence that shows that water insecurity really matters for these nutritional health outcomes too. So RDNs can ask their clients a very short screener that can measure whether that individual has access to clean water, whether they worry about the quality, the access, if they have any interruptions in their water access, and their perceptions of it. In this way, they can gain a better understanding of the water challenges their clients face. And if an individual is distrustful of their water, then they can think about different solutions. One very easy solution that can be implemented is providing water filters. Water filters that can be installed either in under the sink, in a pitcher, or in a refrigerator. All of these can remove contaminants of public health concern, things like lead. If people are very worried about other contaminants, things like forever chemicals or microplastics, then you can get reverse osmosis systems, which are a bit more expensive, but they essentially remove everything from the water, which means that you can have total peace of mind when you're drinking it. And water is the healthiest beverage when you're comparing it to, the variety out there. So I think for RDNs to better understand not only how much water people are drinking, but also their perceptions and experiences with water, that can really help any guided interventions to lose weight or to maintain a healthy diet.
Thank you so much for discussing this topic with me. I think that concept of looking at both objective and then perceived water quality concepts is incredibly important and will be very important to our membership who come to this podcast and listen to what you have told us relative to sort of a summary of this entire water issue. So once again, thank you so much. And our hope is that you will submit some additional articles to our journal as well. Many thanks.
Thank you so much for having me. It was a pleasure to edit this special issue. I'm really happy with the contributions that we have and the rigorous peer review process that JAND has. So thank you again for having me today.
Certainly. Thank you. Thank you for listening to our discussion today. Additional scholarly articles related to today's topic are available on our website at www.jandonline.org. If you found this discussion informative, please like the video and subscribe to Jan's YouTube channel for more content. Thank you for your time and support.